We are beginning a program today, and it's a pilot program which will certainly grow into something larger and larger, and that is a community contact tracing program. We've done contact tracing all along. That a contact is a person who's been exposed to someone that we document to have the COVID infection. When we find someone who has a COVID infection, those people are immediately isolated. But we also work with them to figure out who their contacts were. Luckily, because you have been doing such a great job of cooperating and staying indoors, staying isolated, it used to be there were 10 contacts, at least, for every patient that we would find. Now, it looks like there are probably only 2 or 3 or 4 contacts, not surprisingly, because most people have been staying away from others. And that's good news. But the purpose of this program is to bring on people. We're going to start with 10 people. We may bring on up to 50 or even more as the program grows and as we see the needs for it. As we do more testing, we will find more and more people who have COVID-19. And again, we'll isolate every one of them, and we will find every one of their contacts, and we will make sure that they stay quarantined, and we'll check in with them every day. In other words, what this program means is that we're going to do a more complete job, and we're going to do a more meticulous job of making it less and less possible for others in the county to run into someone with COVID-19 infection. It's not just our county that's bringing more people on. There are going to be thousands of people hired who will be these contact investigators throughout the state. And this is occurring in many, many other states as well, perhaps all of the states in our country. We will be giving intensive training to these people, training not only for identifying and finding contacts, but also in terms of how to be sensitive about doing it. We also realize that as we find more contacts, some of the people we find are going to have trouble being isolated. For instance, if they live in a home where there's only one bathroom and there are 3 or 4 other people living there, and those people don't have COVID infection, we're not going to be able to keep the person in that home. Every person who we're isolating, for instance, needs to have their own bathroom. And so we'll be moving people like this into other kinds of housing that we have available. They'll also have other needs, perhaps, food, whatever it's going to be. The county will be there to back them up and to support them. We just talked about going from phase 1 into phase 2. We feel that it is very likely that we will have the factors that will qualify us to move into phase 2. And what this means is that we will be able to liberalize some of the segments of our daily life here in our county. Working, making money, that is public health as well. And we believe that we're going to be able to liberalize further the business activities in our county, and I think that will be to all of our good.